Hi, my name is Jamie, and today my topic is why Taiwan hasn't legalized suicide. So as usual, we start with a question. Imagine like your families are suffering from cancer, and you know there's no way for them to survive. Will you choose to perform suicide for them? Well, unfortunately, in Taiwan, you don't have this option because in Taiwan, suicide is not legal. Why? There's already a lot of countries legalized it, right? As you can see on the survey, over 70% of people in Taiwan support suicide. So why exactly is stopping us? That's the reason why I'm here today. I'm going to explain the reason why Taiwan hasn't legalized suicide from social and cultural factors and the legal and healthcare system limitation, and finally, the most important one, ethical controversies and risk. So first, starting with the culture and social factors. You probably have a similar experience that you say a small jokes about death and you immediately be punished by your parent. Why? It's because in Chinese culture that people believe death is unlucky. And talk about death, the conversation about death will bring you the bad luck. So, and it's also not polite, right? People will try their best to avoid this topic, but because we don't have opportunity to discuss suicide with our family. For example, you won't ask your grandpa, hey grandpa, when you're dying, will you prefer dying naturally or perform suicide? You will believe this conversation is unpolite and also offend. This is one point. Another point is, about traditional Confucian values. It means 儒家思想. And it have something called the filial piety, means 孝道. People explain this in this topic. Says that you should treat your family good. You should try your best to save their life, not kill them. Or your body is from your parents. You shouldn't suicide. But as you can see, the survey I just gave you, people not really care about this anymore. So I don't believe it will be a big problem in the future. So the next part about the legal and healthcare system limitation. In Taiwan, we've got this called the Hospice Palliative Care Act, where basically this law shapes our doctor, shape the physician as a role who can only withdraw the treatment, not help their patient suicide. So what if my doctor insists to help me perform suicide? Well, he will be prosecuted with assist suicide, also the homicide, which means he will spend his next 50 years in a jail. I believe no one will take the risk, right? And also about the healthcare system limitation. Taiwan is lacking a suicide review system. For the country already legalized suicide, like Netherlands, Belgium, they have a review system to make sure those patients really want to perform suicide, not be forced by other people. So basically, you will have two doctors to review your profile and have a conversation with you, try to ask you a lot of questions to make sure you really want to perform suicide. After all this procedure, you will have a cooling off period. In this period, for example, it's 15 days, and in this 15 days, you can stop the suicide whenever you want. Okay, so without this review system, just legalizing suicide will bring a lot of problems. What exactly the problem is? It brings the third part. The ethical controversies and the risk. So I just mentioned the problem. The problem is the risk to the vulnerable groups. Okay. For example, the illness people, also the homeless or poor people. I bring some example first. For example, illness people, the twin deaf brothers approved for suicide. These twins are going to lose their visual and listening ability, means the only way they can feel the outside world is by touching. It's very tough for their future, and also they're afraid it will become a burden to their families, so they decide to apply for suicide. And their doctors approve it. The reason why it's a controversial case is because against their belief, the government should provide help for them, not approve their suicide. But no, you cannot say who's wrong, right? So the next part is about elder. The elder in the Netherlands started to consider suicide because they are afraid will become a burden to their family. It's because, become a burden to their families. But imagine like this: if the society, all the burdens, most of the elder going to perform a suicide, what will happen to those people who still want to stay alive? Like they have to face the stress from the society. Like why you still living? Why you want to become a burden to your family, even the whole society? They just live with the pressure. And the third part is the poverty-driven suicide. A lot of homeless in Canada starting to apply for suicide because the living cost is too high for them. And they say, well, the price of suicide is much cheaper than my house rent. So see how pathetic the society is that people have to compare their life with money. And also you cannot let the society think that suicide can become a solution of poverty. That's not a suicide, that's murder. So we cannot let these things happen. Also, we need to consider another situation is how do we define unbearable suffering? Physical pain, for example, cancer, can you count it? If yes, what about the physiological pain? Depression? Also, what about existential suffering? We don't have a clear standard. How can we define these unbearable suffering? We can't. So it would be a controversial point in this topic. And then next is the physician ethical concern. After the patient's feeling, we also need to concern about those physicians' feeling. The Taiwan Medicine Association said that suicide violates the medical ethics. And also, I didn't find a similar survey in Taiwan, so I get the European one. Only 22% physician willing to perform suicide. Well, it's not hard to understand, right? Because you want your doctor to kill their own patient. It's very tough for those doctors. So you can see, just few people were willing to do this. So in the end, the conclusion, we talk about the culture and social factors today, and the legal healthcare system limitation and ethical concerns and the risk about why Taiwan hasn't legalized suicide. Maybe these things can be solved by educations, and you can teach people how life is important and cannot compare to other things. But if the problem's still here, we cannot just legalize it because it will bring a lot of problems I just mentioned before. And in the end, I just want to say that life choice should never be driven by pressures, whether it's from society, whether it's from your family, whether it's from the money, from your life, it shouldn't. And in the end, that's all I have to say. Thank you for listening and hope you have a brilliant winter vacation. Thank you.